women make up 79% of the government public health workforce. And so when we also put that in a larger context of the healthcare workforce broadly, women make up 80% of the healthcare workforce. So that's doctors, nurses, techs, all of these positions within the healthcare workforce. Women actually are very much on the front lines right now, working to keep America safe, to keep us healthy, and to keep us, from spreading this virus. We need to pay attention to it and take it seriously. Take science, take medicine, take public health seriously. We think about the workload right now for women who are on the front lines working in public health and healthcare. If we can decrease that by keeping people healthy, that's something everybody can do. The ripple effect of putting strain on any public healthcare worker, especially right now, especially if they are women, can be debilitating to our public health efforts right now. The public health and the healthcare systems are limited. We are at the mercy of the public as well. There are discussions right now about the need for more precautionary masks and gloves and the precautionary materials and resources that are needed to keep the hospital staff also safe, and also keeping individuals who are hospitalized safe. That's when we start to see the loss of lives that are beyond just transmitting, COVID-19. We're seeing the loss of lives because of a lack of the number of healthcare respondents needed, the number of healthcare workers needed to continue to take care of those who are very ill, who are in the ICU, and people who will come in for emergency still, and women who will continue to have babies, right? All of these other scenarios that will continue to happen in the midst of a pandemic. Paid sick leave is something that we're talking about right now. And paid leave is certainly an underlying driver of inequities in the workplace. So this is a priority for us in times of healthcare, always, but especially so when women are on the front lines of our crisis. I would just encourage Americans, right, to contact their legislators, to encourage them to pass some provisions around this, but something that is permanent and not something that's just to alleviate this situation right now. Please listen to your public health officials, subscribe to the Twitter account, to email updates, whatever you can for your local public health system. This is what we train for. This is what we do.